Today we will see about what is reflective learning. The reflective learning is a process which is involving critically analyzing the past experiences. Either it is a positive or negative, we are going to analyze it. So this one will bring the behavior modification and ideas and feelings will be there. For example, how this reflective learning will be implemented in nursing. If you take the nursing field we are having lot of we have a short duration of the time and n number of field we have to post this one, and nursing field is the emerging field. What is emerging? This is newly emerging. Forensic nursing is coming and will be cadaver nursing. Cadaver nursing means we are the nurse who is dealing with the dead bodies, removal of the organization and the ambulance. And then if you take the minor OT, major OT, and the various kinds of surgery, for example brain surgery and kidney transplantation. So every students may not be getting opportunity to look into the surgery for the stipulated period. For that, the nursing professionals or the teachers or the clinical instructor, what you have to do, this reflective practice they have to follow. For example, this can be implemented to the even the newly going to the students also. For example, my own experience, what I have done, when we were studying with boys, so we went to the labor room. First I saw the first normal delivery. When the baby come out, I fainted and fall down. And one more my friend was there, he was a boy, I do not know what happened, and no teacher was asking how was your feeling of labor experience. And this one we friends were discussing, so what's happening, Ramesh, what happened, like that. This Ramesh, I know this boy, how he was with us, and he told, Helen, you don't believe it, after seeing the labor I understand how it is a difficult process. And what did I do, what my behavior, I totally changed. Whenever I am traveling, any lady coming, I never used to give place in the bus or wherever I am traveling. I really respect. Hereafter I take in my behavior modification, I will never fight with any ladies. They are equal to God, I respect them. So the total behavior has been changed. For example, new diseases are emerging. The COVID situation is not going to arise again. Or so how the nurses face the pandemic situation personally, how they are affected. For example, that one. And in the ICU, some of the ICU, sometimes your posting time will be free, sometimes it will be more critical patients will be coming. What is your feeling? So once I was posted in ICU, I have still remember the peep 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 sound. Whenever there, my heartbeat will be increasing. What was my feeling when I was posted in ICU? The one small baby came from Palakkad. The baby is a blue baby. She snake bite, the baby already died. And next patient, we always go with the doctor's rounds. Doctors will be teaching. So he will, some things he will teach in front of the patient. It's a bedside clinic he will conduct. We will be learning. And this learning experience will not be suitable for another. So clinical instructor take that and ask with in front of everyone, what did you learn? So this is the transformation of knowledge from the one student. What happened? Next patient he was talking is a fire accident. Only in the below the knee, the age of the patient is only 28 years. The fire is a deep burn below this one, 80% of the burns. He was talking so nicely, but doctor called the parents and informed them, tomorrow he will die. You will not believe, I couldn't sleep after this, all these things, and tomorrow when I went, the patient was not there. So then that day I decided, so what is the field of my experience where I will be planning to take my experience in nursing? Either it is a pediatric is good. Then I was retrospectively assessing when I was posted in pediatric, what and all the trauma I went into it, what and all, how I could cope up mentally with that. Is that able to put IV? So this one has to be clarified. These feelings has to be ventilated by the teachers and to solve and try the students to cope with that. That day I decided that I will go for the maternity. It is so enjoying, and the maternal nursing is very nice. When you receive the baby, you are happy. Like that, the decision will be coming. So as I told you, the clinical instructor put this reflective learning into the students. And the forensic nursing, you can call one forensic nurse and take an interview, reflective interview, how they experience, how they investigate. So the forensic nursing experience ventilated, and this discussion will be seen by the other people. This forensic nurse will be take her to the field of area. So this is how the learning will be taken place. So this is the reflective learning. So you teachers have to motivate the students. It's a student centered approach. and we will see also one demo. Next video we will see about what is called reflective journaling and how we can implement the reflective journaling into our nursing profession to upgrade our profession. Thank you. We will see the real interview with one nurse. Thank you. You are the where you are after your BSc nursing. Do you have any clinical experience? Where did you join? Can you narrate for us? Your learning experience will be reflecting for my learning also.
Okay. So, good afternoon, everyone. Myself Shrestha Shai. I'm an MSc Nursing in Obstetrics and Gynecological Nursing. After completing my BSc, I have joined as a junior ICN Infection Control Nurse in Charnock Hospital, where the time of that was a COVID time, and lockdown was there. And you know the news is and everything that healthcare workers, there was rumor of healthcare workers being affected. If anyone staying in any healthcare worker is staying any other's home, they are also afraid of that healthcare worker. I have faced this type of situation a lot. And being an infection control nurse, there are many protocols that has been introduced in that time that are newer to us, to all healthcare professionals and to the world also, because that disease, that COVID-19 was so new to us. And every day we were learning, every infection control protocols we were learning,
Changing day by day.
changing day by day. When it will like hand washing, we are doing 8 steps. After 8 steps also the infection, nosocomial infection has been arises. Then we have to evolve it in a
One question I have. You have already, as an infection control nurse, you have a various responsibility to take the swab from the ICU and from the nasal, from the faculty, staff.
Every 15 days alternatively we have to assess the take the nasal swabs and all to test the COVID-19 positive result is there or not. And if there are any symptoms like normal sore throat or anything else, the staff is like evacuated from that area and immediately go for the test for COVID-19. And there was 2 zones, like green zone and red zone.
Where were you posted?
I was posted in a red
What
zone.
is the difference between the green zone and red zone that time?
Green zone, the non-COVID patients are been hospitalized.
Suspected,
Non-COVID, totally not suspected, because that time protocol was when you are going for admission, the first test that you have to conduct is the COVID-19 test only. So that time only all the who are positive, who are negative, we know. So the positive cases are in the red zone. And every 6 hourly we are doing gowning and gloving. And that gowning procedure, it takes at least minimum 30 minutes. The gowning procedure alone it takes. And that wearing PPE 6 hours, it is very exhausting for us, for every healthcare workers also.
What was our duty hours you could manage?
8 hours, ma'am.
8 hours.
8 hours, 4 hours in one gown and 4 hours in another. And 30 minutes, 10 minutes we merely 10 minutes we get for the lunch hour. And then in our red zone, it was a hospital of 500 bedded, and red zone was 250 bedded red zone was there, including ICU and ward also. And what are the basic things as an ICN? When I visited red zone, I cannot go to the green zone, because
you are not allowed to go.
I was not allowed to go the green zone. And I got infected from that red zone only. Being an infection control nurse, it is my saying that I got infected. But the transfer of disease, it is.
In which period you got infected? The wave 1, wave 2, or?
Wave 2, the Delta wave period.
It was very, by the time you were infected.
I was infected and
2 vaccine over?
Yeah, 2 vaccines were over. 3 vaccines were over actually.
Then Omicron, Delta.
2 vaccines of Covishield were over. Then I got infected. Then I took Covaxin also, because I got infected before Omicron. And in Omicron also I got infected. And 2 times in 2 waves I got infected. In Delta, when I got infected, when I suspected to infected, the authority as well as my family and me decided to resign the job. And now I can tell I was bound to resign the job because of my health status. And as me and all the health workers, even that staff nurses who worked 6 hours in one gown, that was so exhausted for us. Even one skin cannot be opened. If there is one skin in glove between the gown and glove,
then also wearing this kind of PPE instrument, and also you got infected.
Yeah. like full gowning and gloving, everything, every method we were following.
What
After
was the
that,
biomedical waste management? Any changes did they bring during the COVID time? I know they will follow the biomedical waste. What did they do there?
the whatever the fumigation and all, we normally non-COVID era we used to fumigate ICU monthly once, and in ward we yearly once. But in COVID cases, it is in a 15 days once, and in ICU it is in a 7 days once. And that in that 7 days when it will be fumigated, that time all the patients, all the ICU patients has to be shifted somewhere, and those patients are already positive. So for that, the green zone area is been reduced. All the things have been
Become a red zone.
And it was very difficult for us, for the management.
The patient's rate is increasing. The nurses rate is same.
Nurses rate is same, and the nurses are got affected also. Whoever has the mild symptom, they are working with the symptoms of COVID-19 in a red zone. Like there was a very scarcity of healthcare workers, so who are affected in a mild symptoms, that they can work in 6 hourly. Also, they used to work with the infection in a red zone with the infected patients also. So it was a huge work pressure for us as an ICN. Yes, I have, and staff nurses also. It was a huge work pressure for us.
Huge work pressure. So ultimately, you have resigned your job
Yeah,
because how was your saturation?
Yeah, one memory I have, that in a night, that in the wave of second wave, when the Delta came, there was, as you all know, there was a scarcity of oxygen cylinder and no vacant bed was there in the hospitals also. So I have to quarantine myself in my own home. And in a night, because I have some asthmatic problem as well from my childhood, in a night it was 11 o'clock and my saturation got down in 74. Then no oxygen is available, no bed was available, only deep breathing exercise that I can do. And by doing deep breathing exercise, and my parents were so furious, so traumatized in that situation. And by God's sake, in 1 o'clock almost, the saturation got 85. And when it was 85, we all were released.
Then still it is low.
Still it is low after doing only that deep breathing and spirometry I used to do. By doing this only, the lung capacity has been increased.
Okay.
And that Delta wave, and both of my parents had that comorbidity. So infection, transmission of infection, that was a fear of me also. And this fear
You may
also,
spread the infection to your parents because they
also
have comorbid condition, diabetes, hypertension.
and this fear also worsened my infection. For this fear and for this nervousness also, I felt that infection is like it is getting more stronger. For this also, saturation is been decreasing.
Thank you, Sreshta. You have taken us there, me there. So viewers, you understand my interview with Sreshta. She has taken me to the place as an infection control nurse, brought the scenario where how she worked with the very risky zone area as an infection control nurse and how she managed the situation. So this is her learning experience. Either the positive. What is the positive point? Positive point of Sreshta is she managed 1 year very nicely, and with the PPE she could able to manage. This is a positive experience you can take it. And PPE, and then many things you have learned. And what is the negative? Though she is a very good nurse, she has developed her own illness of the COVID, and it is also affecting her family. So from this her learning experience in this one, her feelings, her behavior is also. So this situation, the viewers can learn how this one. You cannot bring another re-emerging COVID situation again. So in future nurses who are all visualizing this video, in future, what are all the things government has learned, what are all the patient has learned, the scarcity of cylinders, scarcity of the healthcare professional, how the India has managed. Everyone was very much afraid. American death rate is very high. What about the India? How somehow like these kind of the healthcare workers in our this one, and the immune power of our nation. Of course we are supplying the healthcare people, but scarcity somehow very smart way we have managed. The whole world learned the lesson to overcome that. So I hope by looking at the reflective learning, you also learned how to do it. I hope all the viewers, either the students or the teacher, any single, the new students going to the clinic, tell some of the times, some reflective learning, I tell some of the new students, they will tell, madam, I made a very good report. One teacher came and scolded in front of the patient, so I want to quit the nursing. See, where is our mistake? Is it very good approach? We have to student centered approach. Children are very this is the scenario, everyone having 1 or 2 children, it's not a 10 children. It's very sensitive part of it. I'm not telling, always to be student centered approach, and also use your psychology, don't hurt anyone. And this is the reflection student gave me as a principal. So as a teacher, you imply this everything about the reflective learning in the field, from the clinical instructor to the HOD to the everything, then you can bring tremendous change in the nursing profession. Thank you.